Hi everyone, my name is Dr. Maureen Sieper Gators. I am a nurse scientist and researcher at the University of Pennsylvania School of Medicine in Philadelphia, Pennsylvania. I am originally from Bridgeport, Connecticut. I was born and raised in Connecticut, although my family came from Haiti. So I am first generation American and I'm also first generation college student. I went to Boston College in Massachusetts and received my bachelor's in nursing degree there in 2012. So being a nursing major is actually very difficult, way more difficult than I thought it was going to be. Often people talk about going into nursing as like a second or third option, as like a backup plan, but it's actually very difficult. In my first year, you take anatomy and physiology, chemistry, microbiology, statistics courses, on top of like regular health assessment courses. And so it was very difficult for me to manage that many science classes. With nursing, it's a lot of test taking. And so I wasn't actually prepared to consume all the information, digest it, and be tested almost on a weekly, if not bi weekly basis. So it was to the point where I actually had to drop anatomy and physiology. And I thought I wasn't going to be a nurse. I thought I was going to fail. But I was at a place where they really encouraged me to keep going and actually gave me a grant. So they gave me money to retake anatomy and physiology that summer after my first year. So I wasn't thrown off. I didn't have to repeat any years or extend my time at Boston College, and I was able to graduate in 4 years. I eventually was able to thrive in my major because I asked for help. Often I knew a lot of people, not even in just nursing, but in other majors, where if they failed, they kind of remained to themselves. They became really quiet. They thought they weren't smart, and they didn't reach out asking for help. When you get to college, it's not like a place where your teachers are going to call your parents if you stop doing your homework, or your teachers aren't going to give you detention or anything like that if you don't turn in things. College, you're really on your own and you have to learn how to be an advocate for yourself. So, the ways that I was able to thrive, I was just like, I don't know what I'm doing. I don't know how to study. And so it was the dean, consider the dean like a principal of that actual department or major. The dean actually set me up with a tutor. And so the tutor was able to help me learn how to answer the questions. Again, I said that nursing is a lot of test taking, but the questions are asked in a certain way that I wasn't used to before. My high school didn't do a lot of tests like that or a lot of assessments. So I had to learn how to be a better student. Also, I learned by reaching out to my peers, my classmates. There were some people who were also struggling on one topic that I found easy, so I was able to help them with that. Likewise, they were able to help me on topics that I had a hard time grasping as well. So, forming study groups before exams, even just going after class, like saying, hey, let's review this content together, that was really important and really helped me thrive as well. In terms of the cheat code for surviving a nursing major, it's difficult. I think with any major, you want to make sure that you have people supporting you. I know for me, it was difficult because, like I said, I'm a first generation college student. Most of my family members didn't even have a high school diploma. So if I'm having a difficult time, it's really hard to get support for them. They're cheering me on, they're telling me, yo, you've got this. But at the end of the day, I actually had to pull on some other mentors and I had to find other people who had either a bachelor's in nursing or went to school and talk to them about uh, different areas that I needed help on and asking for their support and getting advice from them on how to choose classes. That is a major cheat code if I could go back, and I've told people before, don't take all of your sciences together. Whether you're pre-med or nursing or some other pre-professional health program, they'll often say take your calculus, statistics, chemistry, biology, heavy psychology classes all at the same time. No, don't do that. So the cheat code is actually spreading out your difficult courses if you can, taking summer classes and getting grants for that at whether at your local community college or at the actual university itself. And that would really help you kind of getting a grasp on the material. Another cheat code specifically for nursing is purchasing or borrowing licensing books. So if you look on different websites, especially for nursing, a lot of the schools are touting, oh, we have a 90 or 100% success pass rate for the actual exam. The NCLEX exam is the exam that you will take to become a registered nurse. So it makes sense that they're building their curriculum off of that exam. So in order to pass the classes, take NCLEX questions, continuously taking questions that are specific to that topic. So if you have an exam on the respiratory system, do those questions about lung sounds, about how to assess with your stethoscope different lung sounds. And so that will definitely help you pass and really grasp the information and know how people are going to ask that. In terms of roadblocks with picking my major, I didn't necessarily have any issues with picking my major, but I think that had a lot to do with how Boston College develops their nursing program. Often schools will accept you as a nursing major, but you're actually not in the program until your sophomore or junior year. And so they often don't tell you that you need to have a certain grade to even make it to that level of nursing courses. So if you're thinking about nursing, ask those questions. Is it something where you're guaranteed once you come in as a freshman, or is it something where you need to score or achieve certain grades to actually get in that program? So that's really, really important to know. What I wish someone told me about the nursing major, I wish they advised me back in high school to take anatomy and physiology and to take statistics. Granted, I did think that I wanted to be in medicine. So the calculus in my physics class and the chemistry classes made sense. But if I could go back, I would definitely do the AP Anatomy and Physiology course, and then also the AP Statistics courses as well, and really try to get an understanding of that. Also, I would also shadow different people in the healthcare environment. I wish I had that opportunity to know what a nurse does versus what a nurse practitioner does versus what a physician does versus what a physician assistant does. I wish I had that understanding of what people do, so I wouldn't have been so blindsided. I really do feel like I've been learning what nursing does like over time. And even after having several degrees in nursing, I just learn something new all the time. Another roadblock that I do want to mention is having undiagnosed ADHD. So it wasn't until later on in life that I actually got a formal diagnosis for ADHD, and which is crazy because often when I talk to different friends, they'll say, "Oh, I have that too," or I often can't focus, or I have lack of organization, or it takes me a longer time to do things that people can do like right away and instant. And so for a long time, I thought I wasn't smart or I couldn't do hard things, when really I just needed a bit more time. Often people think that ADHD is a learning disorder, a learning disability. It's not. It's a processing disorder. So the amount of time it takes me to read something and comprehend it, or the amount of time that it takes me to get organized, is different from other people. And so now I get treatment for that. I'm able to understand my strengths and limitations in terms of what time of day I should work. Should I work in the morning? Should I work in the evening? Should I leave hard things like before noon, which I often do, or should I, push off certain things to a day where I can just focus on it by itself? So that's definitely something that I wish someone talked to me more about in terms of different ways that people can learn, and they probably need support. So, if you recall, I probably started this by saying I'm Dr. Maureen Seabrook Gators. Often people are like, wait, but you're a nurse. How are you a doctor? So, I have a doctorate level degree in nursing. I worked for about 3 years in an emergency department in Connecticut. Had a great time there until one day I became a patient in my own ER. I was having terrible stomach pain. I thought I was having an appendicitis, but it turns out I had this huge tumor on my ovary. And through that surgery and the healing process, I started wondering, what if I couldn't keep my ovaries? What if I couldn't have my own children? And so that led me into being interested in infertility in women of color. And so I knew I wanted to go to grad school. I just wasn't sure for what yet. Again, I in college and afterwards, I met so many interesting people. I met nurses who go to law school. I met nurses who are politicians. Representative Lauren Underwood, she's actually a nurse. Um, I met so many nurses who were in leadership. There's chief nursing officers in different hospitals, and so I didn't know what I wanted to do, but I knew I wanted an advanced degree in nursing. So what I did was I went to Winston-Salem State University in Winston-Salem, North Carolina. It's an HBCU, and that's where I got my degree, my master's in nursing as a family nurse practitioner. So I have the ability now to write prescriptions, to do assessments, similar to like a primary care physician. So I can do that work. While I was in that program, I took more research classes to help me understand how to research, read scientific articles, and even develop my own research studies. So I was really encouraged by my mentors to continue on to get a PhD. And so I went to Duke University School of Nursing and I got a PhD in nursing science. It doesn't make me a medical doctor. I have a PhD, but think about like a psychologist. Often psychologists have PhDs. People who study religion, they'll have PhDs and they teach in the academic setting or they research. And so overall, my main job is to research issues that happen in infertility that affect Black women. So I use my degree, my nursing degree, to kind of help me understand the whole person. So I may not work at the bedside, and a lot of nurses with nursing degrees don't, but I still use those principles of care to help influence how I write my articles to appeal to a lot of different people, how I care for others in terms of giving them suggestions and stuff with what they should do with their care. But overall, I'm very happy with where I'm at in life. I am exploring different opportunities. I may become a college professor, depending on where you guys are. I may be your college professor in nursing, or I might go in more of the tech space. So, like, different private companies might hire nurses or nurse researchers to help develop their products. Um, so, one example that I can give is that, there's a lot of nurses who might consult on how to make stethoscopes or how to uh, give patients a better experience. And so, yeah, kind of rambling right now. But overall, I'm trying to think of different areas that nurses are in. So I think I talked about that. So other than that, I'm really excited to talk more about nursing. If you have any questions, please feel free to ask Tiffany, and she can reach out to me as well.